Good morning. I'd like to call the Executive Committee meeting for Wednesday, May 27th to order. If we could get a roll call, please.
Mr. Lear?
Present.
Mr. Washington?
Present.
Mr. Hess?
Present.
Mr. Tholen? Mr. Byrne?
Present.
Ms. Weber? No, I saw her.
I see her.
Carol, your audio's off.
She's muted.
I just can't find her. We see her, but
Are you on mute?
there we go.
Oh, there you go.
Ms. Weber?
Carol, can you hear us? Carol, are you able to hear us?
Volume's down.
Hi, Dad.
We are unable to hear you, Carol. Do you have a... We're going to continue with roll call. We'll come back.
Okay.
Mr. Payton?
Present.
Mr. Kinzinger?
Present.
Ms. Haas?
Present.
Mr. Featherling?
Present.
Mr. Miller?
Present.
Mr. Seroy?
Present.
Mr. Wheeler?
Present.
We have a quorum.
Alrighty, let's try your mic one more time, Carol. Could you say something so we can see if we can hear you?
Oh, it looks like
Is your volume on, Carol? Can you wave? I don't know what to do here.
I
I'm
can.
gonna try.
Maybe somebody needs to call her on by her phone.
I think Anita's doing that.
Are you able to do that, Anita, for us?
Todd's calling right now. Todd, are you calling or you want me to call?
I'm calling her.
Okay.
Alrighty. We'll go through a couple things here just while we're waiting. We have no public comment today, and we have no presentations.
She just
Under approval of the minutes from February 26th, 2020, is there a motion to approve?
So move.
Mr. Washington, a second?
Yes.
Mr. Payton?
Second.
Mr. Payton?
Yes.
All righty, and we'll wait and see if Carol pops back in there. All righty, all those in favor of approving the minutes, say aye.
Aye.
Those opposed, same sign. Motion carries. Now we have the next item is a resolution regarding the reopening of the economy in Kankakee County.
Mr. Chairman,
Yes,
it's Jim Byrne.
yes.
I'd like to comment or start the discussion on it, if I may.
Are you making a motion to approve so we
I
can get
make
into?
a motion. Yes.
Is there
Make a motion.
is there a second on the motion to approve this resolution?
Second.
Mr. Kinzinger. All righty. Now, Jim, do you or one of the group that prepared this want to read it into the record or read it to everybody so they can hear it at home?
I could sure do that.
The dulcet tones of Jim Byrne. Go ahead.
Good morning. Welcome, everybody. Okay, regarding an action plan for the phased reopening of Kankakee County businesses. Bear with me, I'm on my phone in the car, so I have to sort of extend out. So,
Sheriff Downey, I hope
where
you
is?
got that.
Can everyone hear me?
Yes, sir.
Yeah.
Okay. Whereas COVID-19, not severe acute respiratory illness that can spread among people through respiratory transmission and present symptoms similar to influenza, we as Kankakee County board members acknowledge the health care issue we face as a community. Whereas between March 15th and April 28th, 2020, the governor of Illinois issued an executive order relating to the COVID-19 outbreak, which contained numerous mandates intended to protect the public health of residents of Illinois, including closing bars, restaurants, and any non-essential businesses, providing for Illinois residents to stay at home, closing parks and other public places closing all schools, gatherings, of any size, requiring social distancing and various other provisions. And whereas on April 30th, 2020, the governor of Illinois issued Executive Order 2020-32, which extended the provisions of previous executive orders with some modifications through the end of May 2020. The further expanded mandates of the previous issued executive orders by requiring the wearing of face coverings in certain situations, and whereas the duly elected members of Kankakee County Board feel the original executive order, while excessive and overreaching, that would do harm, and not just the individuals, but local businesses deemed non-essential, abided with the original executive order. We feel the extension by the governor of Illinois on April 30th was unconstitutional and put unnecessary mental and financial duress on residents of Kankakee County. And whereas at the regularly scheduled Kankakee County Board meeting of May 12, 2020, Kankakee County Board members Zakulo, Swanson, Eckhoff, and Byrne presented a resolution before the board to discuss the reopening of Kankakee County in a phased plan. And whereas on May 20th, 2020, Governor of Illinois announced that the state of Illinois will move into phase 3 of his reopening plan based on the data he referred to, and since his original executive order and extension of said order. And whereas by referring to the Governor of Illinois' own reopening plan and phases, we, the Kankakee County Board, using current data, move on to phase 4 from phase 3, which reopens offices, salons, barbershops with capacity limits and other safety provisions. Face coverings will be recommended but not required. Any gatherings of 10 or fewer are allowed to move to the next phase. The positivity rate and hospital admission criteria are the same as, hang on here, moving from phase 2 to phase 3. Testing must be available for anyone regardless of symptoms. Contact tracing must begin within 24 hours of more than 90% of the cases in the region, and whereas based on Kankakee County specific data using the Governor of Illinois' own plans and metrics, hospital utilization, hospital bed availability, mortality rates, we, the Kankakee County Board, feel the as the federal government is enabling the 50 states to institute their own reopening plans, the Governor of Illinois enabled each of the 102 counties of Illinois to institute their own reopening plan based on his very own plan. And whereas the resolution using the Government of Illinois' own reopening plan in phases, which reopens child care centers and schools, as well as bars and restaurants, all with safety guidelines from the Illinois Department of Public Health, any gatherings of 50 people or fewer be allowed. Travel resumes, and whereas businesses with certain licenses, mainly states, should open and they're open at their own risk. Their state license. I have attached on the package just so everyone saw what phase 4 is. Their state license can be affected. As we also concur with Kankakee County Liquor Commissioner, public announcement on May 22nd, 2020, recommend the moving of Kankakee County from phase 3 of the Governor of Illinois' phased-in plan to phase 4 on June 8th, 2020, with the only exception of wearing face masks are recommended, not required. Now, therefore, be it resolved on this date, May 27, 2020, Executive Committee, Kankakee County Board makes the motion to move the special full county Kankakee County Board to vote on said resolution with no per diem for county board members attending as special board member. Basically, what we're recommending in this resolution is that Kankakee County on June 8th, based on our own local numbers on using the governor's exact plan, we move into phase 4. Any other? I don't have anything else to say. Colton, you want to add to that?
No, you did good, Jim. I agree with what you just said, and I mean, it looks good.
can put them all up there again.
I have
And I guess, yeah,
Is there any other ones? Who's that? Is it Mr. Kinzinger?
Yeah, Mr. Chairman.
We have two people talking at once. Who has the floor? How about Mr. Payton first, and then Mr. Kinzinger? How about we'll go that way?
Now, looking at the resolution that, that I would love to support, is that fourth paragraph necessary?
the fourth paragraph, which one? Let's see here. Which one is it, Dan?
Fourth down, whereas we duly elected member of the Kankakee County Board feel the original executive order, while sensitive and overreaching, that it would do harm to not just individuals, but local businesses. You know which one I'm talking about now?
Well, this is resolution. Reason we brought it before executive, before if it moves on the full board, is to tweak it if we need to. This is open for discussion and then vote. So this document is not, it's not an etched in stone document. In our opinion, it's something that we can work with. That's why we're here today talking about it and get it to where we get the full board to say yay or nay.
Yes, now that's my question is, can we take that out, that paragraph?
If the committee so chooses and approves, wants to, we could do that.
So is that a motion to amend to remove that fourth paragraph?
Yes, sir.
I'll second it.
Mr. Washington with a second. Now, is there discussion on that specific amendment only, not the broader context, just this specific amendment?
Question.
Mr. Kinzinger.
Question.
Yes.
Mr. Chairman?
Yes, Mr. Kinzinger.
That I'm in Sam's corner, but I think the only thing I want removed in that fourth paragraph is the sentence, just let me find it here again. We feel the extension by the governor of Illinois on April 30th was unconstitutional and put unnecessary mental. That's the only sentence I think needs to be eliminated on that paragraph. Is that what Sam thinks, or does he want the whole paragraph out?
Mr. Payton, do you have clarification, or do you accept that suggestion, or would you rather see the whole paragraph removed?
I think the whole paragraph is excessive.
Okay, so
I mean, I don't see a need for it.
Okay, so the motion in the second still reflects the whole paragraph. Any other comment just about this amendment? Any other thoughts, questions?
I have a question for Mr. Byrne.
Mr. Featherling?
Yes.
Yes. Hey, Jim, give us a summary of what you think that paragraph is supposed to mean. Does it sound like a lot of mumbo jumbo, or is that something you're trying to get across?
Well, I mean, do we feel that the governor's extension was valid? Let's be honest, it did a lot of harm to not just, I don't want to talk about just economics, but mental health, some of the issues we're facing in the county. We have a high number of suicide attempt calls through CANCOM. Domestic violent calls are up on the huge. Our overdoses are on record paces. It caused unnecessary harm.
Okay. Mr. Chairman, I'd like to see us try to leave that in there if we can talk about it.
Okay.
And it's being challenged in the courts as whether or not it was constitutional. So I guess it is up for question if it really is, but it is being challenged whether or not he was constitutionally enabled to extend 30 days. The first 30 days he was fine. It's the extension that's in question.
Yeah,
If we could,
Chairman.
Just a moment, please. Who's asking for the floor?
Mr. Chairman.
That's Steve.
Okay, first Mr. Seroy and then Mr. Lear. We had him down.
Thank you, Mr. Chairman. I think that sentence, the last sentence, is the only pertinent sentence in this paragraph as far as our citizens go. I know there has been unnecessary mental and financial distress on the residents of Kankakee County. Regardless, I understand Sam's point about the rest of it. We're talking about the executive order that some thinks valid and some do not thinks valid, but I truly believe that the last sentence is valid, and maybe Mrs. Haas would have some numbers on the mental stress of our county. I would yield the floor to Mrs. Haas if she wanted to comment on the mental part.
Sure, thanks, Todd. I don't have data on the number of calls that have come in to CanCom. I think that there has been certainly an impact on the emotional well-being of our community, as well as statewide. And I think that sentence would be appropriate to leave in there as well. I would agree with you on that.
Okay. Now we had Mr. Lear.
Thank you, Mr. Chairman. I think I heard Mr. Byrne just saying that that a large part of this resolution is dealing with the extension by the governor, and thus I would wonder if the first sentence is the one that needs to be removed. At the time that the governor issued that, we really didn't understand how much damage COVID was doing, and so I would be more hesitant to challenge the original executive order, because the governor had to act on limited information, but the extension is one that I would support saying what the last sentence is.
Well, that's what this resolution is basically opposing, is the extension. We all acknowledge early on his first executive order, there was a lot of unknown. So I think everybody, there was a consensus. We may not have liked it, but we didn't know what we were facing. As we moved along, the goalposts in the game seemed to change a bit as he extended it. And then we were starting to see, as the extension went on, the harm that was causing our residents, and not just economically, but mentally and in all sorts of ways.
Mr. Chairman?
Yes, Mr. Washington.
I would like to know if anyone can estimate the damage that has been done by this virus through this county and other counties, and could have been done even worse had the governor not instituted this plan. To me, what we're doing is an afterthought, and we know that the virus doesn't pick favorites. The virus is going to act like a virus. Sure, there's been a lot of mental problems, but that's throughout the state, anywhere it is. But to blame the governor for doing these things, I think we're going off the deep end. I think we need to look at it a little bit more thoroughly and reassess what we actually want. We're nearing the home stretch now anyway. So what I would recommend is that we just wait and see exactly what's going on with the downturn of the virus.
Alrighty. Thank you. Now, any more comments about the amendment to remove the whole paragraph of 4? That's where we're at right now, is just the amendment.
Mr. Chairman?
Was that Mr. Lear again?
Yeah. If no one else is going to want to make any comments, I would move to amend the motion and simply drop the first sentence and leave the second sentence.
I'll go to first the person who made the motion and the second. Are you comfortable changing your amendment to include or to remove the first sentence of paragraph 4 and leave the last one? We feel the extension was unconstitutional and put unnecessary mental and financial distress on the residents of the county.
Yes, sir. I will.
You're okay with that? Mr. Washington, are you okay with removing the first sentence as well and leaving the second?
If Sam is okay with it, I'll agree.
Okay. So the motion now stands as, instead of removing the whole paragraph, we'll just remove the first sentence that speaks to the original executive order and just addresses the April 30th extension. Okay, any more comments about this amendment or questions?
Mr. Chairman.
Yes, is that Mr. Featherly?
Yes.
Okay.
What happens if we want to leave it the same? How many people would, I mean, we're gonna vote on this individually?
No, you would vote to approve the amendment first. And if that passes, then it goes back to the discussion about the whole resolution.
Okay. Thank you.
Yep, and if you want to leave the whole thing, then your vote would be no on the amendment, and you'd make a motion to go back and put the whole, or just to leave it as it is. Actually,
So a no
motion.
vote means just leave everything the same.
Exactly. A yes
Okay.
vote means take out the first sentence on the amendment.
Okay.
Any other comments? Is everybody clear on the vote? Yes to have it be just the final sentence. No means leave it alone. Okay,
Mr.
let's do
Chairman?
roll call. I'm sorry, was there somebody else?
Mr. Chairman,
Yes, Mr. Seroy.
I just for the committee, I don't think that takes any teeth out of this document by this amendment. So I think the teeth are still there. So I'm going to vote for the amendment.
And as the one bringing it forward, I'm voting for the amendment. And again, this is a living document. I want to have as many people have a say, and opinions, everyone's opinion matters and thoughts.
Okay.
All right. Well, then let's do a roll call because it's hard to do voice vote on something like this. So if we could do a quick roll call.
Mr. Lear,
Aye.
Mr. Washington,
Aye.
Mr. Hess,
Aye.
Mr. Byrne,
Aye.
Ms. Weber,
Aye.
Mr. Payton,
Aye.
Mr. Kinzinger,
Aye.
Ms. Haas,
Aye.
Mr. Featherling,
Aye.
Mr. Miller,
Aye.
Mr. Seroy,
Aye.
Mr. Wheeler,
Aye.
motion carries.
Alrighty, let's move on to any other part of this that anybody wants to discuss.
Mr. Chairman,
Yes, Mr. Hess.
thank you. I voted for the amendment, but I have some concerns. Last meeting, I asked Mr. Rowe, and I was hoping he'd be on here today, if this means anything, and he said, no, it does not mean anything. I mean, we can vote on this if we want. I just do not feel comfortable telling people to open up when we know that the governor has the option to pull their state license once it is up for renewal. I'm having a hard time. I understand everything that's going on. I talked to a lot of the business people in my district, and I understand what they're saying. But I, for one, am not going to say, yes, you can reopen, and then when their license comes due, the governor says, no, we're not going to do it.
I agree.
Sure. If I could, just a moment, Mr. Byrne. I will point out that nowhere in this resolution does it says the county board is authorizing any business to open.
I understand, but we're giving them the okay.
Not really. We're recommending to the governor that we move to phase 4. That's what this is saying, is at the now be it for resolved, they're recommending the moving of Kankakee County from phase 3 to phase 4, which is reopening. That's the action here. Now, I just want to point that out. I'm not saying your points are not valid. I actually agree. At no point could we ever tell people that they can reopen, because that is some liability that I am and the board should not be willing to accept.
Right.
Correct.
We have no liability insurance if we tell people they can open and something happens. And that should be very clear to this board.
My question to Mr. Rowe is if we would be liable. And he said, and I think I could quote him, he said he didn't think so. Well, we are not in a financial situation that we could be liable for anything.
I agree.
Mr. Chairman?
Yes, Mr. Byrne.
Nowhere when we started this process, even back in May, did we say we are telling people or giving anybody the okay to open. It's always been under the guise of the government shouldn't be telling you to close or reopen anyways. We are simply providing a recommendation to the governor that based on our current data, the same data he looked at in his own plan, we go to phase 4 on June 8th. And in nowhere have we ever said to any business, open, it is not our job to tell a business to open. That's a business decision they need to make. And if they decide to open, they need to be talking to their own lawyers and their insurance coverage, like was discussed May 12th. So,
And
I
that
mean, we've
should-
never,
That
and
should
we
be
can put
written
that in
into
there.
this ordinance, a resolution then, that they need to have
That's why-
proof that they have discussed.
That's why we're talking right now, why we're amending.
Mr. Chairman,
Let me make a quick note here, Mr. Lear, and then we'll get to you real quick. So Mr. Hess, you would like to see something addressed that has to do with liability, or excuse me, insurance and state licenses. In the
It's in the last paragraph.
the last
second to
paragraph.
Second to last paragraph.
Yeah, in the second to last one. We could make that more clear. I had a suggestion for that part as well. So if it's okay with you, Bones, let's wait and address that when we get to that part of the resolution. Is that okay?
Okay.
We revisit this
That's
in a
fine.
moment, because I do appreciate the comments. Mr. Lear then?
thank you, Mr. Chairman. That's part of what I was going to try to do. That next to the last paragraph, actually, I think should be broken into two parts for clarification. The first part of it is a whereas. The second sentence that starts, "we recommend," I think would be worded better if it were therefore be it resolved, we recommend to the governor the moving of Kankakee County. That clarifies what our intention is. And if that is appropriate, I would move to amend the resolution so that that change took place.
Mr. Lear, could I tag something on to your recommendation?
I'm listening.
Okay, it's the word in the first line that says mainly state should open at their own risk. I think we should eliminate the word should, because that is encouraging people to open. If we just say open at their own risk, I think it's much more appropriate from our point of view and our liability, if you will, in this issue.
I would add that to changing that paragraph and make two paragraphs. The first paragraph dropping the word should, the second paragraph beginning, therefore it be resolved, we recommend to the governor.
I'll second the motion.
Okay, if there's a second there. The only other comment I had on this is, I know it's semantics, but it says, with the only exception that wearing face masks are recommended, not required. I think that my own opinion would be that the word strongly be inserted in front of recommended.
Absolutely.
Because
Yep, I have no problem with that.
we do need to emphasize that it is a best practice, not only for your safety, but also think it's a simple act of kindness you can show somebody else, even if you don't believe a mask is helping the situation. It makes them feel better. If you're walking in a business and you don't have a mask on, it puts everybody on edge. And it's your right, but and actually that brings up another point. Businesses can require a mask to go in there. So that's a right business owners have as well. So with this motion, is it okay, Mr. Lear, that I address strongly and then make a note about businesses are allowed to, or always have the right to require masks in their establishments?
Mr. Chairman?
Is that okay with you, Steve?
Yeah, I don't have any objection to that. I would be willing to include that in the motion to amend if there is a second.
Is that okay with you, Todd?
Yep.
Okay. All right, sounds good.
Mr. Chairman?
Yes, so that is the motion as stated with those subtle changes. Was that Mr. Featherling?
Yeah, it's Ron Hunziker.
Okay. Ron first and then Mr. Featherling, I think.
Yeah, Mr. Chairman, when this was read to us, the last paragraph on the first page, Mr. Byrne read that differently than my motion states it, and it does regard face. Mr. Byrne, read that last paragraph of the first page again. It's actually about the second sentence of that.
Point of order, Mr. Chairman.
Coverings are still
Mr. Lear, you had a point of order?
I think this discussion is not relevant to the amendment before us, and I think what Ron wants is appropriate, but it should be taken up after we finish the business on the amendment.
I would agree with that. We need to discuss just this amendment, and then we could come right back to you, Ron, okay?
If we didn't make an amendment, we can make an amendment on that.
Yep, we'll come right back to it. So any more questions about that final whereas paragraph? Any comments, additions, or deletions? Okay, this one might be a little easier. I'll try voice vote on this one. All those in favor of the amendment as stated, say aye.
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 Those opposed, same sign. Okay, motion carries. So we'll get that rewritten up for the full board meeting, or the meeting, actually, this would also institute a special meeting of the board. So we'll address that in a second. All right, now, Mr. Kinzinger, that paragraph, is it the one that says, by referring to the governor of Illinois' own reopening plan in phases? Is it that
Yes.
paragraph?
Yes. The last two sentences, one of those sentences he read differently than is in my motion.
I noticed that as well.
Okay, I'll read them for you. Which one? Starting with any gatherings?
No, above that, let's see where it starts. Start with whereas by referring, and then it goes down to where, and then it says other precautions, then period. Face coverings are still required. You read that differently.
You said
Okay,
recommended, I think.
Yeah, you did.
okay.
You said recommended instead of required.
Oh, okay. Okay. Yeah, well, my bad. I'm trying to, a phone here trying to look for. What paragraph again, Ron?
The last paragraph, page 1, the sentence face.
Whereas by referring to the governor of Illinois' own reopening plan and phases, we, the Kankakee County Board, using current data, moved to phase 4 from phase 3, which reopens offices, salons, and barber shops with capacity limits and other safety precautions. Face coverings are still required. Any gatherings of 10 or fewer people are allowed.
I think that's what he was getting at, Jim.
Okay.
Was you said
Fine.
still recommended, and the word is required in here. Would the amendment be to change that to strongly recommended to match the end of this? Or wait a minute. Or is phase 4 from the governor's plan say that face coverings are still required? I'm trying to figure out which one are you going with there, Jim.
I'm not recommending anything. I just reread what he wanted.
Which one did you want?
I'm game with what you guys want. I mean, this is, like I said, this is what we're here for, to discuss and tweak where needed when everyone feels comfortable with it.
I was referring to Ron.
You know what? He read it as recommended. The statement said required. I like Mr. Wheeler's idea, strongly recommended instead of the word required.
Yeah, that's
fine.
Okay, so there's a motion from Ron and a second from Mr. Washington on strongly recommended. Any thoughts on that? Okay, all those in favor of this amendment say aye.
Aye.
Those opposed, same sign. Okay, motion carries. All righty, moving on. Any other comments about this from the committee at this point? Mrs. Weber. Mrs. Weber?
Mrs. Weber.
Thank you. I just wondered how the county coalition of health professionals and others reacted to this.
You know, that's a good question. I actually have something for the group that I was going to show you before we voted on this whole thing. If you could let us get through the comments and the changes, excuse me, and then I'll show you the data, what's been assembled, okay?
I think your mic's working now, Carol.
Yeah, your mic might be working. Try muting your phone and talking real quick. Carol, give me a test.
Can you hear me? Can you hear me now?
Nope. We'll deal with the echo this time. We'll figure it out for next. Sorry about that. It's probably Jason's fault.
Okay.
All right, so moving on. Any other comments about the way this is written right now? Any changes, any thoughts?
Something's wrong, Andy. A lot of screaming.
Yeah, there's noise in the backgrounds.
Okay.
Mr. Chairman,
Yes, Mr. Lear.
did Mr. Hess have something he wanted to insert in regard to liability?
Yeah, we were putting that in this last paragraph, and it had to do, we wanted to add something to this last whereas, you know, businesses with certain licenses, mainly state, open at their own risk, as their state license can be affected. As we also concur with Kankakee County Liquor Commissioner's public announcement on May 22nd, we recommend the moving of Kankakee County from Phase 3 of the Governors of Illinois' phased-in plan to Phase 4 on June 8th, 2020, with the only exception that wearing a face mask are strongly recommended, not required. Further emphasis to be placed that businesses can exercise their right to require face mask use in their businesses. Now, and there's something in there, I think Mr. Hess was wanting to, and I would agree with that, we should mention something along the lines of, and correct me if I'm wrong or change this, but the county does not have the authority to open or close any business. Correct. This is a right of people as affirmed by the U.S. Constitution or something like that. They should take into account all aspects before they take any action on their own. Something along those lines, Mr. Hess?
It's something where make sure that they're going to be covered by insurance. One of my concerns is if a tavern would open, is their dram shot insurance going to be good?
Well, as of the 29th,
goes to a tavern, has a drink or six or whatever, and gets in an accident, is their dram shot insurance any good?
Well, as of the 29th, as long as they have outdoor seating, then it is in line with the governor's orders. So we have only heard that liability insurance will not cover you if you go against, and this is officially from the insurance companies, liability insurance won't cover you if you go against the governor's orders, executive orders. So that is one thing that people need to consider, and that's what we need to consider as a governmental body as well. So Correct. To your point, you know, the dram shop, it's not something I can answer, but I can tell you what all other insurance companies have said, and that's just that. So as of the 29th, as long as they have outdoor seating, they're in line with the governor's orders. That's why I was able to make that announcement as liquor commissioner.
Mr. Chairman?
Yes, Mr. Byrd.
Again, we're not to keep repeating myself. No one's telling a business to open. This is like this. Adding this amendment is perfectly fine. Government isn't in the business to shut down and open a business unless they violate the law. In this case, we're recommending to the governor, based on his own plan, that on June 8th they go to Phase 4. We do it like as liquor commissioner was posted this past Friday. As long as you're in good standing, abide by the governor's orders, you should have no problem.
So under that discussion point, Mr. Hess, you feel it appropriate would you like to see something added as I had mentioned?
Yes.
Okay.
That was my original thought.
Okay. So is there a second to that, adding a paragraph in there that discusses the business owner's responsibilities?
Second.
There's second by Mr. Miller. So if it's okay, I will paraphrase that, work with the state's attorney's office to reaffirm those, and you'll see the final version with the board. But I laid out the ground, kind of where we were going, and everybody seemed like they agreed with that. It's the business owner's responsibility to make sure their insurance, they're in line with the governor's recommendations or extension of the Restore Illinois order, you know, and exercise their rights as U.S. citizens as they see fit. Just that we cannot open nor close any business on the county level. That's not we don't have that authority as mandated by the Illinois Constitution. So we'll put something in there along those lines. I wished I could say it better now, but I'm on the spot. So Todd looks like he's got a better idea.
No, I wish we could, Andy. I just wish we could.
Yeah, so do I. I really do. I wish that fell under our purview.
Me too.
I'll get into that in a minute. Okay, so any other thoughts about that amendment we'll put in right before the final now therefore area. We'll go with a voice vote then. All those in favor of that addition, say aye.
Aye.
Those opposed, same sign. Okay, we'll make that happen over the next couple of days. Okay, any other thoughts about the way from the committee as it stands right now? I had a couple things I wanted to run through for you to kind of that speak to what this resolution is. Something we had running parallel. Mr. Lear?
The very last phrase regarding a special meeting, with no per diem paid to attending special board meetings. Would that not be a violation of state law, because it would be reducing the compensation of an elected official? I'm perfectly willing to attend without requesting a per diem, but putting in writing that we're not going to pay one, I wonder if that's a violation of state statute.
That's a very good point. Actually, we have set compensation. 2 years ago we set compensation, but it's up to the board members to forego that per diem when they turn in their meeting list. So it's a very good point. We should strike that. That'd be my recommendation. It was a good catch.
I'd agree.
Would agree. So there's a motion from Steve and Mr. Lear, second from Mr. Washington, to strike the per diem note in there. Is there any comments on that? If not, all those in favor say aye.
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 Those opposed, same sign. Motion carries.
Nay. Is that a Jim, nay?
That's Jim Byrne, yep.
Okay, Jim.
Aye on the nay.
Mr. Chairman.
All righty, and Mr. Featherling, yes.
Yep. With the nay vote there, Jim wrote this thing. Is there, we ask him to say why he nays it?
It's kind of odd.
Take a couple of our time to do a special meeting to vote on this resolution as a full board.
The question and the answer, gentlemen, the question and the answer are both out of order. It needs to come during discussion. At this point, I understand his vote, but we can't devolve into that type of discussion after votes where people explain their votes. It's a bad precedent to set, and I understand, but I hope you do understand it's the way you've got to run a meeting. That should have come during discussion. Sorry about that. Or else every time we're going to have people explaining their votes after every vote, and meetings go to 6-7 hours.
Yeah.
So, that being said, everything else in here okay as far as the committee is concerned?
Yes.
Okay. I wanted to kind of, Carol asked about it. I want to touch on a couple of things that have gone on. If we could just get that full screen. Yeah. So this is the regions that the governor had laid out. Obviously not very happy about where we're at. We're tied to data numbers that are Cook County, and our region will be always, there will be a massive thumb on the scale. So one of the reasons that we had this Coalition for Responsible Reopening was to be able to have a team of people that were going to be looking at the data of our region, and whenever reopening was going to be discussed and there was going to be metrics put to it, we would have our local data to be able to support why we were not or should not be considered in this region. I believe it's Region 1. I don't think the numbers are on there, but I believe it's Region 1. It's basically the collar counties, Cook County, and then the edge counties, the ones around the outside of the collar. And there's even vastly different numbers in each of those counties. So the work went on for the past, well, ever since our previous meeting on this at the full board, and it's been a very fast track. So if we could, I want to show you, I just got numbers on Monday of where we're at on some key things. The positivity rate is something that is one of the key metrics. Okay, it's percent of tests coming back positive. So you see where we're at there, that green line in the middle, and it is below what the requirements are to go from phase 3 to phase 4. Okay, I just want to mention that because we're trying to build the case from a business and a health perspective that we don't need to be in the Chicago region. And then when these phases were announced, we also noted that these phases, that the governor has established his own metrics, we are in a different place than many people. So our positivity rate is very low, and we're testing a lot of people now in the county. So that's a good indication. And we also had the other counties that are in there just for from some perspective, if you will. So we can move to the next one. The next slide is the positivity cases. Obviously, Cook County's way up there. We're way down there because we have 100,000 residents, and our numbers are going to be skewed. Now, it also draws into a discussion of, you watch the news and you hear everybody talking about all the positives, the positive cases that are out there. Well, you're going to have more positives as you test more people. It's the positive percentages and really mortality, to me, that speak a lot better to how people are handling this crisis than others. But and I would say that sentiment might be shared by some health officials as well. So that's the positive cases. Now, out of 100, the positive cases, out of 100,000, excuse me, the positive cases are a little bit higher because, obviously we've had, and at the end I'll show you some of this, but we've had a lot of cases at long-term care facilities here that have skewed the overall numbers. When your N number, which means your sample size, is so small, 100,000 people in a county, it tends to skew things when you have large concentrations like we have in a state facility or some of our longer term care facilities where we've seen these numbers go up. So then the positive cases with Cook removed for perspective, because obviously the graph would be huge. So it kind of gives you a better look on where we're at, way down at the bottom of this chart here. So the next one here, these are some of the actual data points. While I can't see those from right here because I'm old now and I need glasses, but it's not a recent revelation here. So it kind of shows you that, where our metric is, it's well below. I believe the 14% is the number that the governor, I want to make sure I've got that here correctly. I'm looking at my list. It's at or under a 20% positivity rate and increasing no more than 10 percentage points over a 14-day period. This is the criteria to go from phase 3 to phase 4. No overall increase in hospital admissions for COVID-19-like illness for 28 days, and available surge capacity of at least 14% of ICU beds, medical and surgical beds, and ventilators. Testing available in the region regardless of symptoms, which we have. Begin contact tracing and monitoring with 24 hours, which we have. So when you look at these next couple of graphs, and this is our data from our county, you'll see that we meet those metrics, all of those requirements to go from phase 3 to phase 4. Now the 28 days, by the way, is up on the 31st of this month, since our high water mark on the 5th of hospital admissions. So I wanted to qualify that statement by saying that, we meet phase 4 on the last day of this month, on the 31st. So we could go on to the next one here. I did want to provide some perspective on the deaths out of 100,000, because we have a high death rate in the county, the highest of all of these, the ones in our region. But I wanted to put some perspective. Each one of these is a tragedy, obviously. But when you start looking at, you start digging into the data a little bit, 18 of those were in hospice care. So they were already terminally ill or obviously in a bad way before COVID became in the picture. 16 of those that passed away were from the hospitals that were not noted as coming from long-term care facilities, just from the hospital. Excuse me. And 27 were from group long-term care facilities, out of all the 47 of the deaths that were at the time of the data compilation that we did. So this is just some things I pulled off on my own to be able to give you some better perspective of what's going on. The ages from 48 to 96, the average age is 80 years old. So take that with also the fact that you're starting to see a lot of negative test results from these long-term care facilities. The things that we needed to address here in the county, we've done very well with. Our health department, our hospital has done an amazing job. The residents have actually, they took that first executive order seriously, and I think it helped. To Mr. Washington's question, I don't think we would ever know what it was going to be if we wouldn't have done anything, nor if we actually bent the curve. All I can say is whatever's going on is working, and I don't think we should stop it doing the right things. But that doesn't mean that I agree with keeping us in phase 3. This resolution has my support because it's urging the governor to take us to 4, which is where the data plays out that we should be. And our public wants it. It seems like this board wants it. And I thought I would at least put some perspective behind what some of these numbers are in the long term. So with that being said, is there any, this is just one part of what the coalition is doing. The other part was to develop checklists and planning and resources for all of our businesses and churches and everybody getting back to life, what they should do and how they should do it. So we basically, and then we're going to put that on the web, on the health department's website. You know, posters people can put up, checklist, you know, anything and everything, what people should do, resources like you're allowed by your rights to require people to have a mask. Some people didn't know that in businesses. So that work was all going on, and then the governor released all of those tools. His office released that toolkit like over the weekend, I believe, and it didn't negate the work that we did. It just reaffirmed that we were on the right track because they provided all these resources, so now we don't have to finish doing that ourselves. So that webpage will go up as people reopen. They're going to be able to have a checklist on what you should do if you're a bar or a restaurant, and what, you know, the seating requirements, and, you know, paper on the table, using maybe plastic cutlery and you know, throwaway utensils and cups instead of reusing and washing. Menus that are paper, you dispose of the menus instead of reusing those. Good solid principles for all business sectors to use. So I just wanted to provide the committee with what's been going on with our community partners in the health department, hospitals, businesses, chambers of commerce, economic development, citizens, pastors. Everybody's been on these calls, upwards of 50, 55 people that have really become part of the coalition. It's broad-based, municipalities, everything. So I don't know if there's questions about that or anything, any comments about the data that I provided. And I've also
Mr. Chairman?
I'll finish this one thing, and then I've given this to our representatives, our senator, our House Rep, Lindsey Parkhurst, and then also our lobbyist, to get in front of the governor and tell him that Kankakee County is not Cook County. We need to be moved into phase 4, and we urge him to do so. So this resolution codifies that ask that I've already had, because that was everybody that's part of this coalition wants our numbers to determine our future, and we want to do things the right way. We just think that 28 days, I see no other, you have to be in each phase in 28 days, and I think about that a little bit, and it makes me, it gives me pause, I guess. There's a legal term that's called arbitrary and capricious. It says, you know, did you examine relevant data? Did you articulate the facts and conclusion that support the choice of 28 days? Does the Illinois Constitution, did it intend for this office to consider all of these facts? And yes, it was, yes is the answer to every question, and that meets the arbitrary and capricious standard in legal terms. So I do think that 28 days, it's not transparent where any of this came from. Other states are 14. Why are they 14 and we're 28 to move between phases? I don't agree with that. I think it's too much of a burden on our businesses, and I want the governor to know personally that this community feels that way, and I'm sure there's many downstate communities that feel the same. So with that, who was the person who wanted to?
It was me, Jim Byrne.
Yeah, Jim.
Mr. Chairman, when the 4 of us put this together, we didn't do what other counties have done, where we presented our own, what we thought, what we wanted. We used the governor's plan. We did. This is data and stuff he looks at. We're using his plan. We're not creating our own, and that's where I believe we are making a good argument when we recommend on June 8th that Kankakee County be moved into phase 4. That's all I have to say. We used his plan. We're not creating our own. We're not, and that's where you get into trouble where, well, they just want to do their own thing. No, we're actually using his data, his plan.
Yep.
Thank you.
Any thoughts or comments regarding what I just said or anything else, Mr. Seroy?
Thank you, Mr. Chairman. I appreciate the data. And I appreciate all the work that the coalition has done to help provide this data. The only problem I have with the data is listing the hospice patients as COVID deaths. Because if you take that number out, we're really at 29. And having somebody that I loved go through hospice, and then having others that have gone through hospice, to blanket them into a COVID death, I feel bad about that, and I just don't like that number added when you have your loved one in hospice, and you know the end is near, and then they label them with a COVID death. And I don't know if that's going on throughout the whole state, but my grandfather, he died, and we had hospice, and they're a wonderful organization, and I would hate for him to had died from what was cancer and then be listed as a COVID death. And that's the only problem that I have with the data, is those hospice numbers included.
Chairman?
Yes, Mr. Washington.
I agree. My wife did not die of COVID. She died of cancer, and she was under hospice care.
Yeah, the COVID deaths that were attributed to or the hospice patients that had COVID as a contributory factor in their passing, I think personally should be considered separately. I don't have other counties' data, but if it was something that was contributed to the death of somebody, everybody that was almost everybody has, I think 100% had some other illness to go with COVID. But when you're on hospice care, I think it tempers a little bit your viewpoint of well, were they passing because of leukemia, or were they in their final days of leukemia and they were succumbing to that and then they got COVID? And I think that's the question. And again, it's horrible either way, but the data is a little bit slighted, I guess, and it could be the other way around, that people passed of a stroke, but it could be COVID related because they don't necessarily test everybody after they passed. So, and we do know that there have been some strokes and some things out there that are from people that have COVID. They didn't die of pneumonia. So, I mean, it could go either way, but in this case, I think it's important to note, and I appreciate that.
She had nodules in her lungs, and that had nothing to do with COVID. It occurred actually before the COVID notice came out, and it was just too late to do anything about it. But it had nothing to do with COVID at all.
Sure. Any other comments from the board or from the committee? So that being said, we have a motion and a second on the floor for this resolution as amended to send to a special full board meeting. And you obviously want to do this before the 8th, I would imagine?
Yes. Well, we have to give 48 hours, so I would recommend maybe Monday or Tuesday.
Okay. We will we'll check schedules on that, but I don't see a problem with doing. We have to call all the board members to make sure they know. So yeah, if we does anyone have a preference, Monday or Tuesday? Let's shoot for Tuesday morning, just in case people have given enough time to adjust their schedules.
It also gives time to amend get the state's attorneys to look at the document and get everything tweaked and fine-tuned.
Sounds good. And realize that, this is a political document, if you will, from the board. The state's attorney will not have any legal opinions regarding this. They're just helping us structure it. So I just want to make sure of that. They're not in the business of these types of resolutions. So, all right. Well, then that being said, is there unless anybody wants a roll call, do we voice vote?
Roll call.
Roll call.
Mr. Lear,
Aye.
Mr. Washington,
Aye.
Mr. Hess,
Aye.
Mr. Byrne,
Aye.
Ms. Weber,
Aye.
Mr. Payton, Mr. Payton,
Aye.
Mr. Kinzinger,
Aye.
Ms. Haas,
Aye.
Mr. Featherling,
Aye.
Mr. Miller,
Aye.
Mr. Seroy,
Aye.
Mr. Wheeler.
Aye.
Motion carries.
Righty. Thank you for your work on this and your patience while we got the supporting data together that would back up any action. That's much appreciated. Moving on. Under legislative, Mr. Lear, you had some things to share?
Yes, thank you, Mr. Chairman. I do have, and many of you may have seen from UCCI, notes on about 5 items that took place during the last part of the General Assembly. The General Assembly did establish a program for dispersing the Federal CARES Fund acts for counties under $500,000. There's a lot of detail there that you can look into if you want to. There's $250 million for local government operations and responses to COVID-19 attached to that program. For the average person, $250 million sounds like a lot of money. When you spread it out over all the local governments in the state, that's not going to do much. A second item, you've probably read in the paper that the budget that was approved by the General Assembly involves a $5 billion borrowing from the Federal Reserve with the hope that future federal funds will repay that loan, or repay that as a loan. A third item that has major impact, and I'm sure will have to be discussed in detail in the Community Services Building, is legislation that expands vote by mail procedures. A part of that is the applications, not the ballots, but the applications are going to be sent to many voters. Election officials going to have the authority, and they'll have to decide whether it's appropriate or not, to set up curbside voting. And also they would have the authority, but they have to decide whether it's appropriate to set up secure ballot drop boxes. Under this, the reason for those drop boxes is so that people wouldn't have to pay postage on their mail-in ballots. Election day is going to be a school holiday so that schools can be used as voting places. As I said, more details probably will come out in the community services meeting. Fourth item, the specific language for the constitutional amendment allowing a progressive income tax was developed, so everyone's going to want to pay attention to what's going on there. Fifth item will undoubtedly be discussed in more detail in the PZA committee. Eligible property owners that qualify for homestead exemption for disabled persons, for veterans, and homestead exemptions for senior citizen assessment freezes may not be required to file application orders in person in order to receive the exemption for 2020 taxable year. Mr. Blair, who's our supervisor of assessment, can undoubtedly fill in the details on that more at the PZA meeting. So if the public needs more detail, I would recommend they listen to that PZA meeting. Those are the items I'd want to lift up.
Sure, thank you, Mr. Lear. I had a couple more that I have that could augment that. along with the $5 billion from Federal Reserve Bank borrowing, there'll be $4.5 billion in other federal borrowing out of the budget. The Rebuild Illinois Capital Project portion of that, which we have money tied to some of that, $104 billion is pay-as-you-go and $28 billion is bonded. Capital projects leverages $10 billion in federal funds and distributes 3.6 to units of local government. It's good to see that moving. We'll figure out how they're going to pay for it at some point. I think that's the question we all have. It also authorized the comptroller to do interfund borrowing. So the state is interfund borrowing. And we know what that movie looks like. We were there excessively in years past, and we have minimized it here in the last few years. But with the current crunch, we may have to go back to moving money around to meet our obligations, and hopefully it's a short crunch and not a long-term solution. Here's something that was interesting. Senate Bill 471. It was a bill that did, among other things, increased the charges from battery to aggravated battery if the battery occurs when a retailer or retail employee is giving public health directions during a public health emergency. You're seeing some of these things where business owners are saying wear a mask and somebody refuses to wear a mask and it turns into an altercation. That's becoming more and more prevalent. The public needs to understand they have rights, but so do these business owners. Let's see here. The education bill, Senate Bill 1569. It's interesting. The bill codifies many of the education emergency rules put into effect in response to the pandemic. It seems like they're learning that they're finding out that remote learning has its advantages, and they may use it more frequently. Mr. Lear spoke about the election stuff, and that November 3rd is going to be a holiday for schools and certain university employees. And let's see here. The government, the omnibus, the Senate Bill 2135 codifies provisions of the executive orders involving open meetings exemptions. So it's my understanding that that will allow us, until we can properly socially distant in these chambers here, that we can continue on with remote. And, we can start to get people back in here, but we have to keep it limited. And it also has to do with the public as well. So we'll be more on that upcoming here. I know you miss coming into the county building, but we definitely want to keep, there's not enough room to socially distance in here for the amount of board members we have and the amount of public. So that was one thing I wanted to mention. This is also something that actually came up during the pandemic. I got a call from a bar that wanted to do this. House Bill 2682 allows bars and restaurants to provide cocktail sales to go. I was very surprised that I got asked if they could do mixed drinks in cups to go. I'm not sure the sheriff will like that idea very well either. Road loading will resuming and resuming. The bill provides for some temporary filing fee relief. It's repealed in a year. So this is not a permanent thing, but I'm not saying I'm a fan.
Root beer.
Yeah, root beer, there you go. Now, I will mention the Senate Bill 685, because we get lots of questions about this. It provides for the permissive waiver of interest and penalties on property taxes. That is something right now that in Kankakee County is a case-by-case basis, request made to the treasurer's office. And so there was no direction on whether the counties could even do that, make that decision for the entire taxing bodies within a county. This provides that waiver, and it has to do, I think it's got a 120-day cap on it. So that's not something we're doing here in the county because all of our units of government, or at least most of the ones I know of, would be impacted. It would cause mass financial distress amongst all units of government. But case by case, the treasurer will have conversations. So I thought that was about it that I want to mention of import on legislative. Any questions or comments? Hearing none, moving on. Appointments, none. Mr. Duval, do you have anything for us today?
No, I'm just here to be available, and if Carol's having issues, do you want me to have Jason call her after the meeting and work through something?
Yeah, we definitely should probably help her out. I think it has to, well, you guys know what it is better than I do. So, yeah, please do. Give her a shout.
Okay.
Any other questions for Kevin?
That, I mean,
I'm sorry?
Hello?
Who? I'm sorry.
Can you hear me?
Oh, yeah, I can hear you, Carol. Go ahead. Oop, lost you again. Any questions for Kevin? All right, moving on. Thank you, Kevin. Appreciate it. Health Department, John Beavis. Are you here, John?
I am on the line, yes.
All righty. I'm sure you've got a lot of information for us today.
Well, yeah, I guess I could. I did put down, thank you for the opportunity here. Let me rearrange some things here. First, Andy, I'd like to thank you and everyone that we've been working with in regards to this coalition. I know, Lindsay and Alicia have been doing a lot of work for me on the underside of this, and I feel that we're making great strides with the work and the information and the work that's being done on the website for that. So I want to say thank you, and then you've been real good about reaching out to me to making sure that nobody's getting their toes stepped on or anything like that. So thank you again. Yeah, we've been real busy here. Obviously, I've got down a few things here. Just we're continuing to work on, obtaining and getting this information, as Andy was discussing, the guidance for the businesses. Or actually, I'm sorry, let me back up a second. I've been working with Keith Winowski in Environmental Health in relation to, trying to come up with some standard operating procedures regarding complaints that we would get regarding facilities that open up against the governor's orders. In relation to that and how that would work. So we're communicating with the state's attorney. We put together some information, and then with a webinar that we had from the state a few weeks ago in relation to their guidance and suggestions on dealing with those types of complaints, possibly referring some of that information to the Attorney General's office. At this point in time, for many health departments, the question is, we could go in and do some of that information, but a lot of health departments in Kankakee is kind of in that position right now, doesn't necessarily have the time, people, or resources as we're, working with the investigation and the contact tracing. But we can create a policy in which, we can document the complaints. We can attempt to, make phone calls and see if we can get education out and cooperation that way as we move forward here. Kind of similar along the lines, I guess, as to, this resolution that was discussed earlier. Obviously we've got some volunteers that have been coming out to help us with our contact tracing. We've got a number of individuals that are able to give us, 2 or 3 parts of a day every week. So that's helping out our nurses so that they can concentrate on the original calls for the contacts once somebody is tested positive. And then, we have a number of staff who are assisting with just the follow-up on the day-to-day basis for those individuals that are quarantined or isolated at home, so that we can follow up and see how they're feeling, make sure if they have any needs or follow up on the contact tracing aspect there. We have a grant that we're in the process of applying for that the state, it's a contact tracing grant that just came down for a number of all the health departments in the state. I'm happy to announce, we filled out a survey a week ago in regards to a wish list of what we thought we would want. And I can go ahead and say this because they've told us we can go ahead and attempt to apply for the whole amount. But, we had turned in what we thought was a pretty bodacious request of $400,000 for contact tracing for the next year. I'm happy to say that we were approved for Thank you, Jim. $2.8. So we are going to try to, do the best that we can to put in for the full amount. It's going to help with staffing, supplies, equipment for contact tracing throughout the entire county. We may be able to partner with a number of agencies in regards to, sub awards or something like that. So we're going to feverishly be working on that in the next 2 weeks to get that submitted. We're not sure. They gave the impression that maybe this is a 1-year deal, but they might space the amount out over, a few years, because obviously on the backside of this, there's going to be a vaccine probably, and then there'll be more money and needs then for when we have to talk about, setting up vaccination clinics and everything. We're getting a ton of phone calls right now from businesses and everybody, agencies that are wanting some information, sending us their plans, saying, hey, this is what I want to do. Do you think it's okay? It's not necessarily something that we would have been doing, pre-COVID, but, we're trying to assist and help in any way that we can. And obviously the toolkit that the coalition is working on is going to help us, turn a lot of those calls this way to get them the information that they need. And then if anyone has questions after that, then maybe we can eliminate, the big calls at the beginning and just do a few on the backside. We've been working on some rumor control. We posted something yesterday. Maybe some of you saw that. With the contact tracing, apparently there's some people out there that are running scams, and they're calling people up saying they're with the health department. They are, asking for social security numbers and proof of citizenship and things like that. Those are not questions that we ask. We are basically going to call you up, tell you that we are the health department. We can give you our first name. It's going to have the phone number is 815-802-9400. That's what should show up on your caller ID. And we're only going to ask like your name, your address, who do you live with, who are your close contacts, and where do you work? That's the information we're going to need for contact tracing. We are not going to ask for things like your social security number, your proof of citizenship, or your bank routing number or something like that. So those would definitely be scams. So we put some information out there for people, to make sure, because just, you get a phone call, all of a sudden somebody says you're positive, your mind might go down a different path for a minute. You give up more information than you should, and then realize you've been had. So we want to try to prevent that. We're starting to look into, discussions here in the building about resuming to what our new normal will be, but I don't think we're there yet, obviously, so we're still going to be closed for appointments only. That's kind of it in a nutshell. I'll answer any questions if anyone has any.
Any questions for John?
Mr. Chairman.
Yes, Mr. Lear.
Mr. Beavis, would it be possible to try to get some sort of public service announcement out in terms of countering the people that are trying to scam? Let me put it this way. A service announcement about what happens when you have to make a contact tracing call. You see what I'm trying to go at?
I do, Mr. Lear, and thank you. I'm sorry. I did have that down as number 9, and I kind of breezed over it. I thought maybe you wouldn't be interested, but you hit the nail on the head. So actually, we have that in the works as coming up with a PSA in regards to contact tracing, what's involved with that, if the health department calls. So basically, we need to, educate people. I think there's still a lot of confusion out there that anyone who lives in Kankakee County who gets tested, if you get tested in South Carolina, but you live in Kankakee County, we will be contacted, that we have a positive case, and then attempt to reach out to that individual. And so that's a good idea. And we've been discussing that this week as to preparing some information as kind of like what's involved with that. So when we call you up, what's the who, what, where, when, how, why of that call, so that, again, people can understand, these numbers at the end of the day don't just show up and that, this is how many new cases we have. I've got 5 nurses specifically working, who've given up everything else that they would normally be doing and are just working on, these 1,000 cases that we have, almost 1,100, we'll pass 1,100 today. So, we've got to do a lot of juggling and reshuffling of work. So that's a great idea, and we are working on that, yes.
All right. Any other questions for John? All right. No, I appreciate all your work, John. This has been a very strange time for all of us. Very different. Every day is not like the day before, for sure. Okay, moving on. Under schools, Dr. Murphy. I don't know if you're here. If you have anything. The VAC. There's no report this month. The county administrator's report. Anita, you had the staffing report.
Do at the staffing report. You've got that in front of you. As you can see, our number is up to 558. I wanted to speak a bit about that because it is an increase. But if you look essentially at our increase, well, this month we have an increase of 2, but we had 6 additional full-time people added to the 911 center, and that is the transfer of those Bradley telecommunicators over to our 911 center. So that's what that increase is. There is in the state's attorney's office, that part-time 4 is additional AmeriCorps employees. Those are the AmeriCorps grant. So overall, the 558 head count, 11 of that 558 is on that AmeriCorps grant. We don't have any time for those people yet. I had time the last pay period for 2 out of the 11, but they still count as in our head count. So plus the 4 today, that'll move over to that seasonal temporary line over for state's attorney's office. 4 addition in probation this year, and that came from the additional grant and aid funding, and then the 6 CANCOM. If you look at the corrections line, you'll see a reduction of 9 head. 4 of those were involuntary. There was 1 retirement, and the other 4 were voluntary terminations. So that's kind of what's going on with our head count. Other than those little hot spots, you really don't see a lot of activity, even, you know, terminations or resignations or additions. We're kind of at a status quo with the exception of those 3 little areas that we talked about. Any questions on the staffing report?
I had one, Anita. I had one question relating to ETSB 911.
Yes.
I should have asked this question before, and it never occurred to me because we haven't had people move over from a municipality since I've been sitting in this chair. But how does how are those positions funded? Is that now out of the county instead of Bradley, or are we reimbursed? How does that work?
Yeah, you would want to talk to Tammy about that, but they are our employees being paid out of our fund right now.
Okay.
If there's a reimbursement trigger with Bradley, that I don't have.
Okay. I'll ask that question for the board and have an answer for you later. Thank you.
Yep. The other thing I thought that might be of note would be the our response in the administration departments to COVID. I think you're all aware that we did close the administration building on March 23rd. We sent all non-essential employees home. Most departments were doing in this building a rotation where they would have minimal staffing. Access was only by appointment. We reopened the building on May 11th. On May 6th, we had testing for COVID testing for all administration building and highway employees, of which we had about 95 to 98 of those, and we actually did 108 tests. So we had a few extra people pop in and get tested. Of those, we had 7 positives. All 7 were asymptomatic at the time. 6 of the 7 stayed asymptomatic throughout the entire process. They're all back at work. The last one, who had some symptoms, returned yesterday. So they all have positions releases. We worked on signage. We used both the state guidelines, we used OSHA guidelines for our return to work procedures, and we wrote a policy for the employees in this building and highway to sign so that they understand. In order to enter the building, citizens and employees must only enter from the Court Street address. They must be wearing a mask. We require a temperature check. And I just want to say the corrections department has been good enough to loan us an employee who's taking care of that for us right now. That's happening at the front door. And we added some, Wes worked on barriers and floor markings to ensure we've got social distancing and some barriers for any public facing departments that wait on the public at large. So I think that's it. Overall, we've had 26 employees that have been off in accordance with the Family First Coronavirus Response Act. And that would be 4 of those were for dependent care action underneath the law. The other 22 were either awaiting testing if they had symptoms or had exposure, etc. So overall, over the last 2 months, we had 26 employees out during different periods of time under the FFCRA, the Families First Coronavirus Response Act.
Any questions for Anita about staffing or anything else? Alrighty. Well, appreciate the report. Just so the committee knows, as far as staffing goes, we're going to be looking at during phase 3, we're still required to take temperatures. It is a best practice. So we're going to, currently correctional officers are currently doing that for us downstairs. If we may end up going with some temporary help because you see some changes in the staffing levels at the jail. Don't forget it. We may, obviously realize that we're down in the bed rental area, but that doesn't mean we're not heavy in the local population. So to the perception, you might think that, well, we don't need as many people. We've actually got, I don't know, roughly 100 more people than we normally would carry. Previous to, I think about a year ago, we've seen our count go way up. So I think those on criminal justice have noted those higher numbers. So I didn't want any kind of false equivalency between our rent-a-bed program being down and the fact that we have higher staffing levels in corrections than traditionally we have. We still have a lot of people. So I just wanted to mention that correlation. I guess moving on, administrative issues, we have some appointments. Brian Stauffenberg to the Manteno Community Fire Protection District and Gene Rademacher to the Grant Park Fire Protection District. Is there a motion to combine and approve those?
So be it.
Mr. Hess, and a second by Mrs. Haas. All those in favor say aye.
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 Those opposed, same sign. Motion carries. Announcing some openings. 1 on the Manteno number 9 Drainage District, 3 openings on the Kankakee County Regional Planning Commission, 1 opening on the GIS Committee for a board member, 1 opening Zoning Board of Appeals, 1 on the Cambria Area Fire Protection District, 1 on the Essex Township Fire Protection District, 1 on the Kankakee Township Fire Protection District, 1 on the Otto Township Fire Protection District, 1 on Pilot Township Fire Protection, and 1 on St. Anne Fire Protection District. And moving on to new business. Does anybody have any new business that we should consider in the future? Any old business of this committee? Or other business? Mr. Hess?
Yes, sir. I'll make a motion to adjourn.
Is there a second?
Second.
Second.
All righty, second by Mr. Washington. All those in favor say aye.
Aye.
Those opposed, same sign. Motion carries. Have a great day.